The downside to privatized health insurance, and we're going to talk about health insurance specifically here, the downside to privatized health insurance is that there is now a third party involved that has motives and interests that are directly opposed to those they insure. Right? Because those that run insurance companies and those that are actually making decisions on whether or not to approve your claim, they have the job, the explicit job of making as much money as possible for them, for the company, and for shareholders. And every time that they approve a claim or an expense, that is less revenue for them and their shareholders and the company. But under a single payer system, we could absolutely limit that incentive or that motive by removing the drive to make money and turning the system into something that works specifically to serve those who need it. Government institutions weren't always meant to make some massive profit like a corporation. Government entities are meant to be profitable insofar as being able to grow and insofar as being able to, scale operations and things like that, but and to be cost effective. But they're not meant to be like Amazon or Google or Apple, where they just bring in billions and billions of dollars in revenue beyond their own expenses. I was actually listening to a debate this morning. I was watching some YouTube videos, as one does when they wake up on Sunday morning. But I was listening to a debate earlier this morning that was where those on the show were discussing this idea of like a single payer Medicare for all system. And one of the guests, he goes by Vaush, V-A-U-S-H on YouTube, started talking about why capitalism and the free market can't provide something like healthcare. Like we can't rely on capitalism to provide something like healthcare. And I thought what he said here was really poignant and something that I hadn't considered in this way before, but I think it's valid. But let me make this clear real quick. I don't think capitalism is evil, and I'm grateful to live in the country I live in. I like America in general. I may not like Americans all the time, but I like America. I like the country I live in. I'm grateful to be here. But it doesn't prevent me from pointing out flaws in the system. I can love the country in the same way that I can love my denomination and my church. And it's that very love for country, that very love for my faith and my faith community that compels me to talk about things that I see as problems and things that can be fixed. You don't let someone continue to exist in dysfunction if you love them. You do what you can to support them and bring them out of it. So here's the idea that was talked about in this debate. So the basic idea was that capitalism works best when goods and services can be exchanged for currency along a elastic price band or elastic price line, right? A price that can continually shift as supply and demand would dictate. So if you don't want a product or you don't want to pay that much for a product, then you don't buy it. And if enough people don't buy that thing, it tells the company that they either priced too high or they made a product that nobody wanted. And this works for most things as long as those things are optional products and services, because the company can respond to supply and demand and they can alter prices as necessary, because that's what's like, if not, they don't sell anything. But the system breaks down when it comes to products and services that are needed. So I have asthma. I've had asthma since I was a child, and I need inhalers. Like I have an inhaler. There's one in my room, especially in the winter. In the winter, it's actually worse for me than any other time of year. Or if I'm like exercising in an air-conditioned place like a gym, then it becomes a problem. There's no way really around the reality that I need an inhaler. I can do all the exercises. I can do all the alternate diets. I can get rid of dairy. I can get rid of whatever. But at the end of the day, when I inevitably have a asthma attack at some point, if I don't have an inhaler, I die. Like, that's it. If I don't have an inhaler, if I don't have what I need to live medically, then I die. I don't have a choice but to get an inhaler. This is the same thing that's true for someone who is diabetic or someone who's on insulin. So when those medications and that health care for those, for any sort of chronic illness or any illness whatsoever is needed, companies are now incentivized to charge basically whatever they want, especially if there's no competition.